Is there different specialties?
There's many specialties. There's orthopedic, and there's hearts, liver transplants, as well as kidney transplants. Then you have your general surgeries, which includes hernias, gallbladders, appendix, and eyes.
Eyes?
Mm-hmm. Yeah, we do a lot of cataracts, corneal transplants, and then ENT, which is your nose, throat.
How do you choose a specialty?
Well, you get to see what you like best, and that's how you choose your specialty.
And what is your specialty? What specialties have you done?
Well, my specialty, I like doing liver transplants, and I did that for 9 years, and it was a great specialty. You get to see people who are in the verge of dying get a brand new life, new liver, and I got to travel with my job. We went on helicopters and limousines to the different locations where our donors were, and then we proudly came back with a new liver for our patient. And that's how I chose my specialty as a liver transplant.
Now, on the job, what does a surgical technician do?
Well, we have to do a lot. You have to be very focused with your doctors. You have to know your anatomy real well to know what's going on in the different types of surgeries, and you have to know which instrumentation to use for the different surgeries that we do. And you almost have to second guess on what the doctor is going to be needing for the different areas that we're doing.
Can anybody be a surgical tech?
Well, if you like excitement, you like seeing people get better, and you don't mind seeing blood and guts coming out of your tummy, or legs being amputated, you can do it if you like the excitement. We see it in a very different way as techs. We don't see it as something gross. We see it as we're healing. We're helping somebody have a better life quality.
How many hours do you work?
I normally work 8 hours unless I'm on call.
What does it mean to be on call?
Well, to be on call, we take 12-hour shifts, whether it's morning or evening, and we get called to do any emergencies that come up, whether they're fractures, accidents from a car, or somebody who's having an attack with their appendix and it needs to be taken out, or whatever. You have to be able to jump in to do just about any specialty there is when you're on call.
What is like the worst time to be on call? Like, what is it most?
Nighttime, because you
Nighttime?
love your sleep and you don't like to be woken up at 1 o'clock in the morning. But that's what the job is, and you got to do it. Somebody has to be there.
Is there a certain time where you're called in a lot?
No, not really. Well, yeah.
Like 4th of July or other
Oh,
stuff?
yeah. 4th of July is a big one because of kids blowing their fingers off with firecrackers. Also, what's another holiday that?
Thanksgiving.
Well, long. Yeah, a lot of food. Gallbladder attacks. Very good, Lolly. I like that.
Is pay different when you're on call?
Absolutely. You get standby time, and it depends on what hospital you work for. They have different rates. It can go anywhere from $5 standby to $12 an hour standby.
And now on to benefits. What benefits do you have?
Medical benefits?
Yes,
Our
benefits.
medical benefits, they also depend on the hospital that you choose. I work for Kaiser, and Kaiser has excellent benefits. They pay for everything. We're covered from our eye exams and dental, our physical, everything.
Now, you said you worked at Kaiser. Is there anywhere else that you worked?
I've worked at St. Vincent's and White Memorial.
What other benefits do you have outside of work?
The benefits as in satisfaction.
Yes.
Well, the satisfaction, like I said before, it's seeing people get good quality of life after being sick.
Why did you choose this profession?
Because it's an exciting feel.
Okay, thank you so much for
You're welcome.
agreeing to do this for me.